Good afternoon, everyone. Myself, Dr. Shashwat Tiwari, heartily welcomes one and all to this auspicious occasion of this webinar, a national webinar on advancement in orthopedic surgery, organized by Homeopathic 360 and Homeopathic Science Congress Society. Our today's speakers are Padma Shri Professor Dr. R.N. Singh, who will be speaking on the topic advancement in osteoporosis treatment. Dr. Ashish Singh, MS Ortho, topic robotic surgery for orthopedic. And Professor Dr. M.K. Sahani, sir, will share his homeopathic approach and contribute in orthopedic medicine. Today's coordinators are Dr. Yashika Arora, Dr. Sanjeev Kumar Singh sir, and our beloved host Mr. Manish, Director of BGN Group of Companies. Now, I would like to give the stage to Sanjeev sir so that you can introduce each and every one of our presenter today. Thank you so much. Over to you, sir.
Thank you, Dr. Saswat.
Yes.
I have a great pleasure to welcome all in our national webinar
Yes.
on advancement in orthopedic surgery, organized jointly by Homeopathy 360 and Homeopathic Science Congress Society. I am thankful to our motivational energy, Dr. M.K. Sahani sir, for deciding the theme and making this program to see the light of the day. It is very much supported by Mr. Manish Jain, Chief Executive B Jain Group of Company, and of course Dr. Yashika Arora by providing all support and platform of WebJam. With our mission to provide the learning and serving motto, are constantly engaged in organizing such seminar and webinar. During this pandemic situation, we have maintained rather with more enthusiasm by organizing such webinar or both international and national level. We have tried to cross the boundary of limitation on different system of medicine and bring a unified platform, integrated platform where best of each system can be made aware and available to all. Our objective is to sensitize and inculcate curiosity for learning by being motivated by expert of the field. So today I'm going to introduce my first speaker, and really it's a matter of proud to introduce such a what you say, the Padma Shri Professor Dr. R.N. Singh sir. I feel fortunate to being associated with sir since 1997 as a Rotarian. It's a really great moment for me to introduce Padma Shri Professor Dr. R.N. Singh sir. Presently, sir is a consultant orthopedic surgeon, Orthopedic Center Complex, AIOR, Kankarabagh, Patna, Honorable Consultant Homeopathic Surgeon, Anup Institute of Orthopedic and Rehabilitation, Honorable Consultant, Red Cross Polyclinic, Patna for the last 30 years. Honorable Consultant, His Excellency, Governor of Bihar since 1998, Chairman Ethics Committee, AIMS, Patna, Member ADHOC Committee, Indian Red Cross, Patna, Member Bihar Rajya Swasth Samiti, Patron Bihar Orthopedic Association. Sir has presented so many research paper also, bacteriological study of compound fracture, geomedic knee replacement, a review study, diagnostic orthoscopy of research paper read at AIO Icon, Calcutta, 1985, and various paper he has presented in state and national conferences, mainly national and international conferences, and presented his papers. Social activities, which is very important for the sir, and really he is inspiring to many. As a assistant governor, Rotary District 3250 in 99-2000, conference chairman 91 to 92 and 97 to 98, chairman Rotary Foundation District 3250, 94 to 95 and 2002 to 2004, chairman Rotary Polio Plus Committee District 3250 in 91 to 2001. Paul Harris Fellow, Rotary International. It's a very important, the thing for a Rotarian, Paul Harris Fellow. And he has received many awards, including the Padma Shri Award in 2010 by Srimati Pratibha Devi Singh Patil, President of India, at Asoka Hall, Rashtrapati Bhavan, New Delhi. It's a matter of proud for all the doctors and especially for the people of Bihar. Patna Siri in 1989 by Rajendra Prasad Pratibha Anveshan Parisad, Patna. Uh, Sahasi Purush Samman in 1995 by Bir Kuwar Singh Sansthan, conferred by His Excellency Governor of Bihar Sri A.R. Kidwai. Seva Puraskar 2001, awarded by Nirman, a voluntary organization affiliated to Nehru Yuva Kendra, Government of India, awarded by Sri Syam Rajak, ex-minister, Government of Bihar. Honored by IMA Annual Conference by Sri Nitish Kumar, Honorable Chief Minister of Bihar. Awarded gold medal by His Excellency Sri R.L. Bhatia, Governor of Bihar, for excellent services rendered to Bihar chapter of Indian Red Cross as Lifetime Achievement Award. Sir has started to build a multi-specialty cancer hospital named Savera in Patna for cancer patients with an investment of rupees 50 crore. The foundation stone of the hospital was laid down by Honorable Governor of Bihar, His Excellency Sri Ramnath Kovind, on 21st January 2016. He has established a rural hospital in his native village known as Golma General Hospital with 100-bed capacity, where regular outdoor and indoor services are provided. This center is located 28 km from district headquarters Saharsa. Center is recognized by Kasturba Medical College, Sevagram, Wardha, Maharashtra as official rural training hospital. Center is linked with AIMS Patna as a distance telemedicine center, which was inaugurated by its director in January 2016. The hospital has 22 acres of land and had planned to have a medical college. The project involves approx 150 crores of investment. So this was a brief introduction of Padma Shri Dr. R.N. Singh sir, and now I request sir to please present your valuable, the presentation. And sir is going to present paper on advancement in osteoporosis treatment. So over to you, sir.
Yeah.
Thank
First of
you.
all, sir, wait a second, please. First of all, I would like to give an introduction about Homeopathy 360, and then we'll continue with the presentation. Okay?
Thank you.
Yeah. Definitely, sir. Hello, everyone, and welcome to the platform of hidden talents and the treasury of knowledge, Homeopathy 360. You think, we link. I, Dr. Shashwat Tiwari, heartily welcomes you to the one of the most updated portals for online publication of all kinds of course materials for students, practitioners, latest news, all upcoming events worldwide, career opportunities, job vacancies, research updates, articles from great classical and contemporary practitioners, periodical literatures, journals, videos, presentations, etc. That is Homeopathy 360 from BGN Group of Companies. Homeopathy 360 has been exceptional educational hub for each generation of homeopaths. As always, we have aimed towards advancement of homeopathy as an evidence-based science and tried to connect homeopaths worldwide and broadcast their talent. We organize every single information related to homeopathy and make it universally accessible, making sure that we are the best at what we do. Now, I would like to give the mic to sir and start with his presentation. Over to you, sir. I'll start the presentation in a bit.
Thank you.
Yes.
Thank you.
Yes.
Now, thank you very much for giving me the opportunity to speak on osteoporosis and recent advancement in the treatment. Now, What is osteoporosis? What is osteoporosis? That's what we have to understand. Now, hello, listening, everybody listening? Everybody listening?
Yes, yes, sir. Yes, sir.
You are listening. Right. Right.
उधर ही आके बात करेंगे अभी अभी नहीं ऐसे नहीं पूछा राउंड पे तो रोज सुबह आते हैं हाँ रोज कल कितना देर राउंड हुआ अभी नहीं अभी मीटिंग में है अभी जाइए
Hello?
Yes, sir.
Actually, sorry. When we osteoporosis, what is osteoporosis? Now I must tell you that normal. No, it's pretty hard. This I think it's not working.
Say the sound is echoing. Don't use the headphone.
I remember.
Yes, sir.
Yes, sir.
Are you audible?
Yeah. Now you are audible. Yeah, now you are audible, sir. Yeah, you are audible.
Right. Now, osteoporosis is a disease of bone which is also known as a silent killer. Why it is not known as silent killer, I'll tell you later. But first of all, we must understand what is osteoporosis. You see, when you use in the morning, you take a cup of tea and you try to strain the leaves in the cup of tea to make a cup of tea, you've got a strainer. This strainer has got certain holes in it. And this is known as porous. So when the normal bone becomes porous, it is known as osteoporosis. Now in simple terms, in Bihar, we have got two types of sweets. One is known as peda, which is made of some sweets which is very solid. You can't press it. But there is another type of sweet in Bihar, which is known as batasa, which is made with sugar, but it's porous inside. Therefore, when you press it, it breaks very quickly. So, the osteoporosis is a disease where your normal bone turns from pera to batasa. That means it becomes so porous that even a slight pressure, when you sneeze, it can break your bones. This is what I want to explain to you. Bone becomes so crippled that it just breaks whenever you slight fall or even heavy sneeze can lead you to that. Now, if you see that's why I have explained it like this, that osteoporosis is a disease that causes your bones to become weak and brittle. And this is a very common disease and can result in fractures from even simple trauma. In fact, it is estimated that 50-year-old women has about 40% chance of having osteoporotic fracture during a remaining period of lifetime. And osteoporosis is important because of the problems resulting from these fractures, disability and loss of independence and even death. Now, why this happens? Up to the age of 18 years in girls and up to the age of 20 years in boys, the bone grows. And the bone growth is dependent on the production of osteoblasts. Osteoblast is the bone formation cells. And after that, after the 18 years in girls and 20 years in boys, the growth stops. And whatever is the calcium and the bone matrix you have, this is known as bone mass. This is known as peak bone mass. And this bone mass remains up to the age of 30 years. 30 years onwards, the balance between the osteoblasts and the dead cells, that is osteoclasts, are balancing each other. Like Reserve Bank of India destroying the old notes and giving the same number of new notes in the circulation, its circulation remains the same. But after this certain age, that is after the age of 45, 50 in ladies, when their periods stop, and case of male who so the osteoclastic activity, that is bone destruction, is more than osteoblastic activity, that is bone formation. Therefore, what happens? That the Reserve Bank is destroying more notes and not giving in circulation the new notes. Therefore, what happens? The scarcity of the new notes is there in the country, and that's why happens in the bone also, that your bone becomes weak. Now, if you go Therefore, what is that? It's a silent disease, and you don't have any symptoms. For example, the circulation may not, if there is no note in the circulation, you don't mind. But there is someday you will feel that, oh God, I can't see any 2000 notes in the market. What should I do with my 2000 notes? I should also discard this. This is what is the problem that occurs. That is, osteoporosis is a silent disease and there are no symptoms. Now, what happens when it breaks a bone? Then you think that, oh, you are suffering from disease. Therefore, we call it that whether the chicken or the egg, which was the first, chicken or egg. Like this, in old ladies, if a lady falls and breaks the hip, it's a big question whether she fell and broke the hip or she broke the hip because of the osteoporosis and then fell. It's a very difficult situation to say. Whether she fell after breaking the hip because of the osteoporosis or she fell and broke the hip because of the osteoporosis is a very difficult question to answer. But normally it is seen that in ladies who are more than 50, they develop a condition known as postmenopausal osteoporosis. Postmenopausal osteoporosis means that the lady has developed the menopause and therefore their hormonal balance has been disturbed, and this leads to a condition known as postmenopausal osteoporosis. But in the age group of 60 plus, 70 plus, in males also, the same situation may come, and that is known as senile osteoporosis. So the ladies have got the problem that they can suffer from postmenopausal osteoporosis and also they can suffer from senile osteoporosis. So combined together, a lady of 65 or 70 has got the tendency to develop more fractures because of the two regions together. So the third point which I have said, when you have this condition, a fracture can occur even after minor injury such as a fall. And any kind of fracture may occur. That depends on what way you fall. Mostly the spine, the hip and the wrist, because when you fall, you try to protect yourself, therefore wrist is injured mostly. When you try to fall, you sit down on the floor abruptly and the spine fractures. And if you are trying to balance yourself, one of your hips may fracture. And it's an inevitable part of the aging, but it's a disease that can be prevented and treated. This is why it is very important to understand this disease and some preventive measures to be taken that it should not happen again. And if a patient comes to my clinic with a fracture of the hip on one side with osteoporosis, it should be our duty to provide them that treatment so that she doesn't come again with the fracture on the other side. The main goal of treating osteoporosis is to prevent fractures on the first place. But if we cannot do that, then we'll see that this is what the pictorial thing that I can show you is that the first picture that you can see the normal bone matrix and the second one is the osteoporotic bone. And usually this happens with the hip and the spine and the vertebral region. And you can see the picture number A that the bone matrix is normal and the osteoporosis, the picture below. Now this is again same sort of things that osteoporosis results from loss of bone mass as I explained to you. Now common risk factors for osteoporosis. The very first thing that the sex, that is female. As I told you, because of the most postmenopausal osteoporosis is there, therefore female is very important. The postmenopausal osteoporosis, family history of osteoporosis. There are certain patients who peak bone mass at the age of 20 is not good enough. Therefore, by the age of 30, when the imbalance between the osteoblastic and osteoclastic activity occurs, they develop fracture, and this runs in families. So there is a family history of osteoporosis. Now, if you don't do exercises, if you don't improve your muscle, you will find that you are weaker. As you see in cases of polios. If you see in cases of polio where the muscles are paralyzed, the bones of that particular leg is also weak, just because the muscles are not working properly. So the blood supply of the bone is hindered and therefore bone does become strong. Similarly, if you don't do exercises, your bone will also suffer the osteoporotic difference. Now, if there are certain people who have got a small body frame, their congenital situation is that they do suffer from osteoporosis. low calcium intake, and importantly, the vitamin D deficiency. Vitamin D deficiency, and if this all are added by the smoking, the age, that is what I say, starting the mid-30s, but more likely with advancing age, and certain diseases like rheumatoid arthritis, hyperthyroidism, hyperparathyroidism, hypogonadism, and there are certain medications that can lead to this osteoporosis, and that is, these are known as iatrogenic conditions. Means we have produced, now we have, doctors give the drugs, and therefore the osteoporosis develops. That is corticosteroids and certain thyroid hormones we give, and sometimes we give diuretics for kidney Lasix type of thing, kidney diseases, and some drugs like anti-epileptic drugs, Dilantin and Tegretol, etc. This also leads to problem of osteoporosis. If we go ahead, now question arises that do you have osteoporosis? Osteoporosis causes only symptoms when it's so advanced. And in the beginning, you may not feel that you are suffering from disease. But when it has caused fracture, it has got the disease. So you must be careful that in certain age group, you must have your tests done to see whether you are suffering from osteoporosis. Now, symptoms. No symptoms is there to suggest you that you are suffering from osteoporosis. But there are certain symptoms which can give you an idea that you may have. For example, in ladies, you will find that their height is decreasing. The height is decreasing, you will find that because of the fact that there are so many vertebral bodies which reduce in size. So if there is 2 millimeter reduction in the height of the vertebra, there are so many vertebrae which reduce, and it may lead to 1 or 2 inches of loss of height. And you will find that the ladies are getting smaller and smaller and smaller. And the symptoms include loss of height because of a deformed spine. And then there are certain situations where you can detect it while you are treating the bone. For example, you have got a fracture in road traffic accidents or somewhere, and you come to the orthopedic surgeon. There we find that no, this patient has already got osteoporosis. And then we as a doctor, we must see that if we are treating somebody with certain drugs which can lead to osteoporosis like corticosteroids, then we must also inform the patient that possibility of osteoporosis is there, and they must get this tested by certain available parametric instruments, that is DEXA and other instrumentary of the bones, to know what is the status of the osteoporosis. Now, why this happens? This is what I was coming to say. Now, first of all, we must know that the whole thing, osteoblasts and osteobone, and then osteoclastic activities. Now, osteoblastic activities, as I tell you, that this is a new bone formation, and then the osteoclastic activity, which is the destruction of the bone. So this cycle goes on. And this cycle, if you take this one, if you go on osteoblast formation, function and survival, yes, this keeps on going. And this circulatory management is going on in the normal circumstances. But in the abnormal osteoporotic circumstances, the osteoblast becomes more, and the osteoclast becomes more, and osteoblastic activity is reduced. Now, how to understand? This is what is there. We can have the video, please, for this. Dr. Saswat, can you have video?
Dr. Saswat, are you here?
Can we have the video for this?
Yes, sir. Yes, sir. I'm presenting it. Wait.
Video 1, yeah.
Yeah.
Now you see that how the bone matrix inside is there, and then as the osteoporosis develops, the whole thing becomes more and more porotic, and it can lead to fractures. What happened? Think. Now, this becomes less calcium in the bone, bone equilibrium, the disturbance in the bone equilibrium. As I said that the formation and destruction of the bone is disturbed. Let's go further. Regeneration of the bone is osteoclast breaking down. Now there are certain treatments which lead to destruction of the osteoclast, and therefore osteoblast formation is more and osteoporosis is being treated. Now, first of all, we must make a diagnosis of what stage of disease is there and how to proceed for the treatment. Now, the best method, the World Health Organization has suggested that the best method of testing the osteoporotic status of the body is dual energy X-ray absorptiometry. That is known as DEXA methods. What is bone densitometry? This is a way to measuring the amount of bone. This is important because the amount of calcium in your bone determines how strong it is. If the bone density is very low, then you have osteoporosis, and very high, there is a risk of fracturing your bone. High risk of fracturing the bone. A standard X-ray is not a good way. A standard X-ray, you can see the X-ray and say that the patient is suffering from osteoporosis. No, because the exposure depends on the texture of the bone. If you see normal X-ray, it depends on what sort of exposure is there. If it is highly exposed, the bone will become white. If it is low exposed, it will become osteoporotic. So you can be misled. So the best way is to call dual energy X-ray observatory, that is known as DEXA, which is very common, and it's a very simple instrument that the patient lies, and you can do that. The whole thing scans your body, and you can find out that the whole thing gives you the whole body scanning, and especially the normal bone and osteoporotic bone, especially the spine and the hips. Now, DEXA method also, the World Health Organization has given the T score. There is a T score, means they say score between the age of the patient, the weight of the patient, and the BMD, that is known as what you call the DEXA method. BMD of young people is good, whereas when you go for the old people, the T score is dependent on the body weight, body mass, and the age of the person. So this is known as the T score. Now T score up to 1 is normal, -1. Now if it is -1 to 2.5, -2.5 is known as osteopenia, and after 2.5, -2.5, it is known as osteoporosis. Now here I have come out a word known as osteopenia. You will ask me, what is this? Now normal bone and the real osteoporosis, there is a midway, and this is known as osteopenia. Means ki aapko your bone structure is less than normal, but not exactly causing osteoporosis. This is osteopenia. Like you call in English thrombocytopenia. Less is known as penia. So this is osteopenia, means your bone is less, but not to that extent that it can be called as osteoporosis. Therefore, it is known as osteopenia. There is one condition I must also explain, that is known as osteomalacia. So osteomalacia and osteopenia are two different terms. Why? I'll explain you this. Now, if you have got vitamin D in your body, vitamin D, how does it work? The sun and exposure on the skin gives you vitamin D3, which is 25-dehydroxycholecalciferol. Now, this dehydroxycholecalciferol is hydrolyzed in liver to form a molecule known as 25-dehydroxycholecalciferol. This goes through blood into the kidney, and in kidney it is further hydrolyzed, and this is known as 1,2,5-dehydroxycholecalciferol. This 1,2,5-dehydroxycholecalciferol is the effective vitamin D which comes to your intestine, and in the intestinal wall it is present to absorb your calcium that you eat. If you can take kilos of calcium from mouth, but it will not be absorbed unless there is a presence of 1 to 5 dehydrocholecalciferol in your intestinal wall. Therefore, sometimes the patient, because of the lack of vitamin D, their calcium absorption may be low. The osteoclastic and osteoblastic activity is all right, but bone becomes malleable because of the less calcium, and this is known as osteomalacia. So the bone becomes little bit like if you take a 24 karat gold, you can bend the biscuit like that. But if you add something like some impurities in it, it's 22 karat and it becomes very hard. Even 18 karat gold is very hard. Therefore, the solid bone is very nice. It's a complete bone, but the calcium is less. Therefore, it becomes malleable, and this is known as osteomalacia. And these type of patients in children, they are known as patients suffering from rickets, and in adults where the growth plate is already fused, they are known as osteomalacia. In ladies, this osteomalacia leads to give a deformity of the pelvis and ultimately leads to difficulty in childbirth, etc. Therefore, we must also understand in young ladies, when there is no osteoporosis but the bone is weak, this may be osteomalacia. So here, this is a very important description between the osteomalacia and osteoporosis. So DEXA method also gives you the idea that whether this patient is suffering from osteoporosis or osteopenia, or if both are not there, then osteomalacia may be there. Now, who needs this? This on the DEXA method. Now, any person who are coming in that group, a lady which is more than 55 years of age, if they have got bone pain, if they think that they have got a fracture because of the trivial trauma, they must be examined to get this, that you should be treated for the osteoporosis. Why this is important? Because treatment of osteoporosis, when we come in, we'll go further how the treatment treated. Now you will find that the giving calcium, giving vitamin D, and physical activity are the basic principles of treatment. But at the same time, we do have to think about that something must be done that the calcium absorption is better, and we can go ahead with some other treatment, or we should go for some other treatment. Now, calcium. Make sure you are getting enough of calcium in your diet, but as I told you before, the calcium cannot be absorbed unless you have got a good, the calcium cannot be absorbed by the gut unless you have got good amount of vitamin D in your body. And 800 to 1000 international unit of vitamin D is actually required every day, and that comes from different food sources, but the best source is the sun that you should go in. And physical activities again is very important. Now, how to treat this? This is what it says, right? Another slide. Now, some people will also need medication. Once you give this primary treatment, there may be some patients who will need treatment. Now, today, we have got so many treatments for the osteoporosis, and these are the principles of, first, that we should supplement the calcium, which is less in the body, number one. Number two, if we cannot do that, then we try to arrest the destruction and improve the formation. And then there are certain that we should balance both. So this is the treatment we go for. So the very first thing is that in the prevention of osteoporosis, there are a group of bisphosphonates. What is bisphosphonates? Bisphosphonates is a group of drugs which is anti-absorptive, means destruction, it stops destruction and helps to slow the bone loss. And studies have shown that this can increase the risk of fractures. With all these medications, you should make sure that you are taking enough of calcium and vitamin D, and that vitamin D levels, your body must be in good normal situation. What happens now that you have brought so many people to get your home repaired, but all of them arrived at your house, that your new house will be started to be constructed, but there is no raw material. Those people will not be able to help you. So even if you give somebody bisphosphonates, that yes, it will normalize our blood destruction and formation, you must have the materials with you. That is the calcium and vitamin D you must have. If you don't have that, then ultimately you will have no effect of the treatment that is for there. Now, there are so many bisphosphonates, that is alendronate, regendronate, and ultimately these are the drugs which is given either weekly, monthly, or yearly. We can give. Now, recently, we have gone into another group of drugs, that is calcitonin, and in ladies, where we think that the post-menopausal osteoporosis is because of the hormonal disbalance, there is a method of treatment known as HRT. Which is this HRT? Hormonal replacement therapy. A lot of people give estrogen, a little bit of estrogen, which is reduced after the menopause. Formation of estrogen is reduced after menopause. So some people give estrogen so that the post-menopausal osteoporosis is delayed. But this may not be right because you can't fight with the nature. So it has been seen that these ladies who get HRT, they develop a condition known as breast cancer and the cervical cancer they develop. Therefore, HRT has been stopped, and even if it is necessary to be given, it has to be given with caution under medical care. There are certain drugs which are not actually estrogen, but estrogen modulators. They do the work of estrogen, but they are not actually hormones. They are known as riloxafen, a group of drugs known as riloxafen, but this is also long-term treatment. We have seen that very, and therefore this should not be given, and if it is necessary, it should be given only with caution. Now, selective estrogen, this is what I'm saying. This is the riloxafen group of drug. And then very lately, we have got a drug known as teriparatide. Teriparatide is a form of parathyroid hormone that stimulates the bone formation. It is approved for the use of menopausal, postmenopausal women and men at high risk of osteoporotic fracture. It is also approved for treatment of glucocorticoid-induced, cortisol-induced osteoporosis, and is given in a daily injection dose under the skin and can be used up to 2 years. Now, this teriparatide for first 3 months we should give subcutaneously, and then we can repeat it after 6 months or so. Bisphosphonates. Now, long-term bisphosphonates has also been warned to be treated with caution because long-term bisphosphonates use may cause gastric cancer and also cause some sort of unexplained osteonecrosis of the jaw, and sometimes it can cause, so if you give bisphosphonates for a long time, they can cause unexplained fracture of the upper femur on both sides. These are the certain unexplained complications of bisphosphonates. Therefore, we are looking for new drugs to prevent osteoporosis. But basically, we must have the basic ingredients, that is calcium and vitamin D, enough in your body, supplemented by all these drugs. And overall, the general living, that is proper exercises, walking, avoid smoking, avoid alcohol, and eat fresh fruit and good hygienic life gives the maximum supportive treatment to the osteoporosis. Thank you very much. You can ask.
Dr. Sanjeev?
Yes, sir. Thank you very much, sir, for your valuable presentation. And I'm sure all the participants has got enlightened. Very rightly, you have said and presented about the osteoporosis. And being a homeopath, I can say there are so many information as rubrics in our repertory related with this osteoporosis, like bone brittle, fragile, and so many medicines are also there. But I'm sure that today's speech lecture of Padma Shri Dr. R.N. Singh sir going to open so many the windows to see the diseases related with the bone in a different way and a different aspect. So it's a really a very, very good, informative speech, and I'm thankful to you, sir. So thank you so much. And now proceeding further to our next speaker. Yeah, our next speaker is Dr. Ashish Singh, MS Ortho, and I'm glad to introduce Dr. Ashish Singh. The most important thing what I have observed about Dr. Ashish Singh is that a very mild and gentle person, and always keeping a smile on his face. So, going to introduce Dr. Ashish Singh, a consultant orthopedic surgeon at Anup Institute of Orthopedics and Rehabilitation, heading the orthoplasty unit. Dr. Ashish joined this institute in July 2015 and have successfully performed more than 200 total hip and knee replacement, including primary complex joints and revision of failed hip and knee orthoplasty. Had formal training and fellowship in lower limb reconstruction from Royal Infirmary of Edinburgh, Golden Jubilee National Hospital, Glasgow, University Hospital, Oxford, and Musgrave Park Hospital, Ireland. Got the opportunity to work with the master in the field of hip and knee orthoplasty. Dr. Ashish had a formal degree and exposure in computer assisted orthopedic system and performed hip and knee replacements with navigation robotics. Dr. Ashish done revision total knee replacements and have evolved over time to become an orthoplasty surgeon with a special interest in lower limb adult reconstruction. Also have a special interest in pelvic acetabular trauma and routinely performed various procedures. Consultant orthopedic surgeon and medical director, Anup Institute of Orthopedics and Rehabilitation, Patna, Bihar. And he has presented so many papers at both national and international conferences. Academic pursuits and publications, complications and re-operation rates after revision, total knee replacements in a single surgeon series published in Journal of Bone and Joint Surgery, British Proceedings, in August 2013, volume 95B, number SUPP 31, Ashish Singh and David Nicole. Second one, sarcoma excision and pattern of complicating sensory neuropathy, accepted in Journal of Oncology, published on 24th March 2014, Neil R. Vikram Singh, Nicholas D. Clement, Ashish Singh, and Daniel E. Porter. Oncology, volume 2014, article ID 16869. Another one, publication in Asian Journal of Orthoplasty, acetabular defects, impaction, grafting using sandwich techniques, ISSN 4335673, volume 3rd, issue 2nd, July 2018. Another one, a comparison of functional outcome after conservative and operative treatment of intra-articular fracture of calcaneum JFAS 871R1, submission selected under review. He has received so many awards. Eminent Educationist Award by Rotary Patna Midtown in April 2018, awarded by Honorable Health Minister for pioneer in robotic and navigation orthoplasty surgery in Bihar in October 2018. Young Doctor of the Year Award by Medget Today by Honorable Health Minister of India in March 2018. Best Poster Award at Maharashtra Orthopedic Association 2007, University Topper and College Topper in Final MBBS, University Topper in Medicine in Final MBBS. So this was the brief introduction of Dr. Ashish Singh. Now I request Dr. Ashish Singh to present his valuable paper. Over to Dr. Ashish.
Sir, thank you, sir, for very nicely actually presenting my CV, and I'm very thankful to Dr. Sahni sir and each and every one of you for arranging this wonderful conference and asking us to speak. I'm also thankful on behalf of my father. And is my voice audible?
Yes, yes.
Okay, so I'll proceed.
Yeah.
So
Yeah.
Yes,
this
sir.
is yes, this is a term which I always use. जोड़ों से जुड़ी है जिंदगी, जिंदगी से जुड़े हैं हम. So we are the joint replacement surgeons, and my father has been trained from the father of arthroplasty, Sir John Chandler in Liverpool, and I've also been extensively trained. And since 1994, actually, we have been the pioneers to bring joint replacements surgeries at your doorsteps at Patna. Now, sorry, next. Now, the important thing is that I already explained my CV. Anup Institute is a 100-bedded hospital dedicated to orthopedics, and we have subspecialties under orthopedics. I would like to focus today to a very, very new topic, robotic making joint surgeries easier and safer. Now, number one is to understand joint pain. So joints are basically involved in all the day-to-day activities, and most importantly, the weight-bearing joints, right from ankle to your knee to your hips, are mostly prone to arthritis, but the wrist joint, the elbow, and the shoulder joints also are involved in arthritis. And pain is very important because it makes the patient come to a doctor, and then we have to understand at what stage the patient is, so that is it the stage of surgical intervention, or we can go ahead with medicines and other forms of treatment. Now, joint degeneration, as described by Dr. Arun Singh, is due to one of the reasons is osteoporosis, which is more frequently seen in ladies. But joint degeneration causes pain, and it is constant or intermittent. It occurs with movements or after a period of rest and may be located to one or many parts of the body. So joint pain is the first thing which comes, and then you have to come to a doctor or see a specialist. Now, if we focus on the knee, the knee joint is formed by basically three bones, and the patella, the kneecap, which is commonly called as the kneecap, and the medial compartment, and the inner compartment, and the outer compartment. And one ligament is attached to the fibula, which is supporting bone in the knee joint. Now, all these are integral part, and anything if goes wrong leads to early degeneration. Importantly, what is the knee pain for India? It affects more than 15 crores people in India, and people become debilitated and they have deformities and they start presenting late with a lot of problems from our side. Now, to understand the progression of osteoarthritis, it is very important to understand the type of pain which the patient gets. The patient usually complains that I have pain after getting up from sitting position. They start having pain in using the Indian toilet, or they are unable to go up or down the stairs. So this is the first complaint, and it is at that stage where if we intervene in a proper way, then things can slow down. But basically there is medial compartment, अंदर के जोड़ का arthritis, the outer compartment lateral, बाहर के जोड़ का arthritis, और आगे के joint patella और femoral का patellofemoral arthritis. So तीनों arthritis एक साथ भी हो सकता है, अलग भी हो सकता है. The three forms of arthritis can be together or can be differently. Now, usually it progresses. As you can see in this diagram, that the knee is covered by a very soft cartilage sort of structure. It is actually the shock absorber along with the menisci, and with age, with time, and with other problems, it starts degenerating. And there the patient complains of pain. Now, as I discussed, that pain can be inner side, outer side. So most importantly, it is very much important to understand that where is pain coming from, and simple treatments like reduction of weight and some exercises around the knee will help you to get the pain better. Now, if we focus on total knee replacements or robotics, basically it is the number of joint replacements over the world is increasing day by day. The center where I used to work, we used to perform roughly 12,000 joints per year. So that was the calculation in one center. And over time, the knee joint prosthesis, that is the implant used, the techniques are getting better and things are getting better, and at the same time early mobilization is happening because patients are being mobilized within 6 hours after the surgery. Now it is very important to understand the evolution and planning when we talk about technology. Total knee replacement was evolved roughly in the 1950s and 60s, where we used to have a lot of instrumentation and then do the surgery, understand each and every bit of it. But then in 1990s, the navigation, the use of computer came. Then the navigation, that is the use of computers, was embedded in the power tools in 2000. And finally, the robotic arm assisted surgery. So robotic arm assisted surgeries, this is the world's latest technology. But most importantly here to understand that the robot does not do the operation. It is under our guidance and we do the surgery, but under a 3D planning and a virtual modeling, we plan everything and then the execution, in the execution part, it is held by the robot so that we are 100% perfect. Now, importantly, what happens that when you're doing a knee replacement or using computer, the eyes cannot identify errors to the to the extent of 1 or 2 degrees. Now, in this example, you can see the F is lines are parallel, but if you just put E and F, you can jolly well say that E is also parallel and F is also parallel. But unfortunately, you will see that F is roughly 1 degree and F is 0 degrees and E is 1 degree. So the computer is very good in identifying 0, 1, 2 and 3. And in knee replacements and hip replacements, if any of these things go wrong, it may substantially affect the outcome. So now over the world, we have more than actually 2000 robotic joint replacement centers. And it is the way things are evolving, especially in America and in Europe. Now, we have the robotic platform that is the first in Upper India, and it is very important because we are giving and providing 100% success rates over the past 2 months, what we have done. Now, what you need to understand that if you see the photo on this side, left side, you can see the robotic arm. Earlier, when we used to do a knee replacement, we used to do with the saw, and it usually is eyeballing technique. You put your jigs and understand the calculation, but you never get the differentiation that it is going wrong or right. It is only when you come out, see the X-rays, then you say, okay, I could have done this. But when you're on the robotic platform, or for that matter on the navigation platform, you are always sure what you are doing. And the execution part, you can see my hand which is on the robotic arm, and I'm seeing on the screen, and everything is going picture perfect as you see in the manufacturing factories. Now, basically, how can this be achieved? Because it is CT based planning. When we do an X-ray, X-rays are two-dimensional. We don't know, we just see the X-rays and we can't plan much. But when we are on the robotic platform, we take a CT scan for the best bony morphology and then we plan accordingly. So CT based planning, and we do a dynamic planning before the surgery. So basically the surgery starts before the patient enters the surgical theater, and we plan and know the sizes option which is ready, and we are
Absolutely dead sure, because it is a CT-based planning. Now, on the table, when we open the knee joint, we do a dynamic planning. So what we have planned and what is on the table, we match. And then it is a real-time dynamic assessment and intraoperative adjustment occurs. Now, as I was telling about the lines, in a knee replacement, it is very important to have your angles right. For example, the tibia, the leg bone, has to be cut 90 degree at a slope of 3 degrees. Now, this is not actually possible by robotic, non-robotic or our hands, and we tend to assume that yes, it is 3 degrees. Now, second thing is that the saw which we are using is guided by our hand. Now, when we have hand guidance, you have to retract and manipulate the knee a lot so that you don't injure the collateral ligaments. Those are the ligaments which are protecting the knee, and the vascular structures which is present behind the knee. But when we are on the robotic platform, we have a haptic boundary, and we don't need to retract the knee much because the saw will not go outside the haptic boundary, the line which is seen on the computer. Now, it has also got AccuStop haptic technology. That means that if we are going wrong, either the robot will give us visual feedback that you are wrong, haptic feedback that it will just grumble, and last is that it will stop, but it won't let you do wrong. Importantly, what makes us better is we know more because of CT planning, and we are more concerned about the outcomes. And over the last 10 years, the results which have come up in the literature shows an improved survivorship. That is, the knee or the hip is going to last forever because every alignment is dynamically planned and executed as well. Now, the most important thing is that we are cutting very less because we are CT based. The plan is CT based. So if we want to cut 1 mm, we can plan for 1 mm and then we can do the balancing. But if it is a normal instrumentation, we cannot cut less than 2 mm. So even we have the discretion to cut 0.5 mm, 1 mm and balance the knee. So we are cutting less. And the range of motion is the dynamic assessment which is happening. So what I am trying to tell that patients, you are cutting less, it helps us in faster recovery and it helps in reduced pain post-op because we are not damaging any tissues and the patient outcomes are really becoming better. This is a small video. May I request to play this, please?
Definitely playing.
The video is
घुटने हमारे शरीर के और अहम जोड़े हैं ये हमारे हर मूवमेंट को सेंट्रलाइज करते हैं तो अगर आप या आपका कोई अपना आर्थराइटिस के घुटनों के दर्द से जूझ रहा है तो उन्हें चलने, बैठने या घुटनों के बल पर झुकने जैसे रोजमर्रा की चीजों को करने में तकलीफ हो सकती है। आर्थराइटिस आज हमारे देश के 15 करोड़ से भी ज्यादा भारतीयों की डिसेबिलिटी का प्रमुख कारण है। घुटनों के दर्द का एक इलाज होता है टोटल नी रिप्लेसमेंट। इस प्रोसीजर में बिगड़ी हुई हड्डियां और कार्टिलेज को निकाला जाता है और फिर सर्जन नी जॉइंट के बीच एक इम्प्लांट बिठाते हैं। इस सर्जरी से घुटनों के मोशन और फंक्शन काफी हद तक पहले की तरह हो जाते हैं। हमने नी रिप्लेसमेंट सर्जरी को एक नई टेक्नोलॉजी के साथ जोड़ दिया है और ये आर्थराइटिस से पीड़ित लोगों के इलाज का एक नया दौर स्थापित करता है। मिलिए लियो 2 से स्ट्राइकर मेको के द्वारा एक रोबोटिक आर्म असिस्टेड टेक्नोलॉजी जिसका इस्तेमाल AIOR के सर्जन्स टोटल नी रिप्लेसमेंट्स के लिए करते हैं। ये अनोखी 3D रोबोटिक टेक्नोलॉजी हर पेशेंट को देती है एक पर्सनलाइज्ड सर्जिकल अनुभव जो आधारित है उनकी शारीरिक रचना पर। लियो 2 हमारे सर्जन्स को उनकी सर्जरी एग्जीक्यूट करने में पूरी तरह से सक्षम करता है और साथ ही सॉफ्ट टिश्यूज और लिगामेंट्स को नुकसान से भी बचाता है। अब हम आपको इस टेक्नोलॉजी के खास फीचर्स बताते हैं। पहला स्टेप होता है डिटेल सीटी स्कैन। सीटी स्कैन मशीन एक्सरे के जैसे ही पाँव के अलग अलग एंगल्स की तस्वीर लेता है, जो आमतौर पर सर्जन्स सिर्फ एक एक्सरे से शायद ना देख पाएं। ये टेक्नोलॉजी का सबसे बड़ा कमाल है। 3D वर्चुअल बोन मॉडल। सीटी स्कैन इमेजेस सॉफ्टवेयर में लोड होते हैं और बनता है हड्डी का एक वर्चुअल मॉडल। इसका उपयोग होता है सर्जरी के पहले एक पर्सनलाइज्ड प्री ऑपरेटिव प्लान बनाने में। इससे सर्जन इम्प्लांट के प्लान साइज और प्लेसमेंट को रिव्यू करते हैं और जरूरत पड़ी तो सर्जरी के दौरान पेशेंट की अनोखी शारीरिक रचना और जॉइंट मोबिलिटी के अनुसार इम्प्लांट का पोजीशन भी चेंज कर सकते हैं। सर्जरी के दौरान सर्जन घुटनों पर पॉइंट्स लोकेट करते हैं, जिससे सॉफ्टवेयर में पेशेंट की एनाटॉमी रजिस्टर हो सके। इस प्रोसेस से लियो टू पेशेंट की एक्चुअल एनाटॉमी और प्री सर्जरी वाला वर्चुअल मॉडल दोनों को मैच करता है। ये स्टेप सुनिश्चित करता है कि एनाटॉमी का 3D मॉडल मेन रजिस्टर कराने के बाद ही इम्प्लांट सर्जरी शुरू हो, उसके बगैर नहीं। और हम इससे सर्जन प्री ऑपरेटिव प्लान में मॉडिफिकेशंस भी कर सकते हैं। पेशेंट की एनाटॉमी और गति की सीमा के आधार पर फिर सर्जन को लियो टू रोबोटिक आर्म अपने अति आधुनिक लीनियर सॉ के द्वारा आर्थराइटिक बोन और कार्टिलेज को घुटनों से निकालने में गाइड करता है। ये रोबोटिक आर्म कभी भी सर्जन को प्लान से ज्यादा बोन कटिंग अलाउ ही नहीं करता। अगर सर्जन प्लान वर्चुअल बाउंड्री के बाहर गए तो वो टैक्टाइल रेजिस्टेंस यानी पुश बैक देता है। स्क्रीन पर हरे रंग में सर्जन को विजुअल क्यूज दिखाई देते हैं ताकि वो देख सके कि कितनी हड्डी निकालनी है। सामूहिक रूप से ये संकेत सर्जन को प्री ऑपरेटिव सर्जिकल प्लान पर बने रहने में मदद करता है। रोगी हड्डी के रिमूवल के बाद सर्जन बनाई गई जगह में इम्प्लांट फिट करते हैं। जब सर्जन इम्प्लांट और नी मूवमेंट से संतुष्ट होते हैं, तब सर्जरी समाप्त होती है और सफर शुरू होता है रिकवरी रूम की तरफ। और चंद ही हफ्तों में पेशेंट फिर से अपने पैरों पर। लियो 2 वर्ल्ड्स बेस्ट ऑर्थोपेडिक टेक्नोलॉजी नाउ इन पटना, पावर्ड बाय स्ट्राइकर मेको।
Next slide. Thank you. अब नेक्स्ट स्लाइड कर सकते हैं। ये सर स्लाइड आ जाएगा, ठीक है। ये सर सो बेसिकली ये एक विवरण था जब हम लोग टोटल नी। मेरी आवाज सुनाई दे रही है ना सर? हाँ, basically this was a small present which showed how we are using the robotic platform in a total or a hip replacement, or for that matter in unicompartmental replacement. So MECO, that is a robotic surgery versus conventional total knee replacement, we know more and cut less. The final bone cut and the implant position is all guided by the robot and executed by the robot in under our control, so the things and the results are better and the pain is obviously less. Over the past 2 months I've done more than 27-30 cases approximately, and the most important thing is that all the patients are able to get up and mobilize 6 to 8 hours after the surgery. Number 2, the patients are can do active straight leg raise without bending their knee. They can lift their legs on day 1. That is, if operation is done today, from tomorrow, and stair climbing is also done the second day. The first day. Second day, the patients are mobilized, dressing is done, and the patients are going home at the third day. So in this Corona time, when people don't want to come to surgery, but they have to have a surgery for betterment of their life, this robotic knee replacement, hip replacement, the execution is done with perfection, and less is everything. Less is bone cut, less is pain, less is hospital stay, and with efforts of my father, Dr. Aran Singh, and yes, and less blood loss. And we have kept no extra charges for the robotic surgery. For example, if you happen to visit any hospital, definitely all the hospitals are charging extra for the navigation, which we have it from 2014, but we are not having any extra charge. So this is basically becomes a part of our corporate social responsibility, and our aim is to have world-class service for every surgery at your doorstep at Patna. Apart from that, most important thing which I would like to reiterate is less is everything, less is the bone and soft tissue damage, less need for analgesia. So less is the painkiller requirement, less is the hospital stays early discharge, less is the blood loss, less is the patient physical therapy session, because you have so much controlled protection of the soft tissue that injury is less and patients are mobilized within 6 hours. That is as soon as the anesthesia wears off. So basically, the difference is because we know more and cut less. CT-based planning. It is intelligent tool holder with no use of cutting jigs. The saw is different, and there is a lot of transformation in the technology over the past 30 years, which has been happening. Apart from that, we have burr technology. If we have the bone saw is not able to penetrate, so we have the burr. We can use the burr to do the stuff, and we have one Mako product specialist, because this is FDA approved as a robot. So we have a person dedicated to the robot who stays and helps us. He does not wash in the surgery, but he is there for everything. Most importantly, the most important thing is that why are then we still using traditional conventional techniques despite lot of evidences? If you are a patient, what would you choose your surgeon to do? A 60 to 70% accuracy, or more than 98% accuracy to the extent of 100%. So it takes time for technology adaptation. Everybody was using phones which was non-touch phones, but now everybody has a touch phone, and we have to have ask the people that yes, have simple phone. Change is the law of nature, and it is already happening in some surgeries that there is telesurgery, like we are having a teleconference today, and progress is inevitable. Technology is here to stay. We only the forms will change and become smaller and smaller with time. The technological gadgets will become smaller. And nature's law, those who embrace the change will survive, those who don't will perish and retire. So I think with this small talk, I would like to end here, because robotic knee replacement is a system which helps us to get great results, but it is very important to understand that when the patient should be referred to an orthopedic surgeon, and pain in any form, the orthopedic specialist should be referred, and then we can take care, because we have newer medicines which can also delay the advancement of osteoarthritis. And we always have the aim in our mind that we don't want to operate the patient, so we can give medicines, but an essential early diagnosis, as told by Father Dr. Arjun Singh, that DEXA scan is good. Over here we have many medicines which can slow down the progress of disease, but if progress cannot be stopped, total knee hip replacement is the way we can get going and take it from there. Thank you. Any questions?
Thank you so much, Dr. Ashish Singh. It was really very beautiful and informative presentation. And I would like to say it was a very painless presentation. So you bring joy in one's life who is having the pain. And sir started with osteoporosis problems and all, and you gave us the solution. So thank you so much for your very beautiful presentation. One thing I would like to request Dr. Aryan Singh sir and you too, Dr. Ashish Singh, just be with us after the presentation of Dr. Sahani sir. There will be some question answer session. So please be with us. Dr. Sahani sir, now I'm going to introduce Dr. Sahani sir. He's my guru and guardian. It's a very great pleasure for me to introduce my guru, Dr. M.K. Sahani, educationist as well as well-known practitioner of homeopathy, was elected anonymously chairman of the Education Committee of Central Council of Homeopathy, Government of India, New Delhi. Dr. M.K. Sahani has been serving the Central Council of Homeopathy for the last 22 years as elected member. He was member of the various committee as well as chairman of the Homeopathic Literature Committee. His long journey in teaching accumulated as vast storehouse of information finally elevating to the authorities level of professor. With his deep interest in homeopathic philosophy and ambition to visualize in practice, he mastered in repertory, materia medica, and homeopathic philosophy as well. Soft-spoken Dr. Sani is popular among his patients, for whom his caring heart experiences the pain and misery, giving solace to them. His patients are distributed in and around the globe. He is now accepted as expert, and patients are referred to his expert opinion. Dr. Sahani perfectionist nature led him to work tirelessly. He never retires until the work is completed. He had various activity related to homeopathy and was deeply involved in the foundation of Research Institute of Sahani Drug Transmission and Homeopathy at Patna, for which he was the founder managing director and later on took up the highest position of its chairman. Research Institute of Sahani Drug Transmission flourished and now established as non-government organization working basically for the research and development of homeopathy. He born on 17th September 1952, had his schooling at St. Xavier's School Hazaribagh, Jharkhand, and graduated BSc at Ain College, Patna. He completed his DHMS course from Bihar University and MD from SKH Medical College and Hospital, Beed, Maharashtra. He is the first PhD from MUHS. His father, late Dr. Bandhu Sani, a popular physician who discovered transmission of homeopathic drug energy from a distance. Dr. Sahani has extended his discovery of his father to great extent. Presently, Dr. Sahani is the only expert of the transmission of homeopathic drug energy from a distance. Recently, his article is published in international peer-reviewed journal of critical review. So now I request Dr. Sahni sir to present his valuable lecture on homeopathic approach and contribution in orthopedic medicine. Over to Dr. Sahni sir.
Thank you, Dr. Sanjeev. Today I am very proud that I am speaking before our great master, our mentor, our supporter. I say right from my very young age, I remember the day when I got fallen and broke my shoulder joints, and this was the first acquaintance. So sometimes some people fall in love after the accident, and this was my love with Dr. RN Singh since that right time when I broke my shoulder joint. So I enjoy breaking my shoulder joints, and since that time, and at several occasions, I was helped by him, and every time it was so wonderful. I cannot explain in words. And that during our association in Rotary, I had a great opportunity to listen to him and his messages and his understanding about the life, as well as his presentations on the various topics. I heard him many a time speaking on the orthopedics and everything, and every time it was a mesmerizing talk. Mesmerized. We are always get enlightened with so much. So thank you, sir, for your very nice presentations. And I'm also proud that we have the artist. I have seen him growing from his childhood and this age, and several times at his house and at Rotary and various places. And you have just a proud son for the proud father. And I will bless you all for many more success in your life. Now, with this my gratitudes and to the Dr. RN Singh sir, I have to just add on, because orthopedics is basically the subject that belongs to Dr. RN Singh and Dr. Ashish. And here in homeopathy, we only have the contributions to minimizing the pain and reducing and helping in supporting the bone to get joined again. And that's why I am just trying to put some of the inputs about what homeopathy can do in the matter of orthopedics things, bone disorder. See, homeopathy is one of the most popular medicines which was initiated in Germany, and it is a holistic system of medicines where everything is taken care. If you have broken your hand, if you have broken your leg, that for that also we need to understand why you have broken and what was intentions and which it was intentional also. These things we take into consideration. And the selection of medicines is based upon the theory of individualization. We don't have any ready-made medicines. We have the individualized medicines for each and every patient. It is a tailor-made medicine. We are taking the detailed history of the patient, and for every individual patient, we have the different medicines. Suppose a man is broken with his fractures, with his hand or something else. We are not going to give the arnica to each and every patient. We have to analyze what type of the medicine, because there are hundreds of medicines in our Metromedica which can be best suited to an individual patient. And this is the only way through which the state of complete health can be regained, by removing all the signs and symptoms from which the patient is suffering. The aim of the homeopathic treatment is not only to treat the bone. This is very important. We are not taking care only of the bone, but the bone in the man. That means it has to be the individual susceptibility, and underlying cause is very important for us. So totality concept of symptoms is adopted to represent the disease conditions. And by totality, we understand the mind, body, and spirit. The combinations of the mind, body, and spirit, and the fundamental principles are life cures the life. Friends, homeopathic medicines are most compatible to the human life. In homeopathic medicines, they are not a chemical contents. We don't have any chemical contents. There are no chemicals present in any of the homeopathic medicines. As such, there are no chemical reactions. Medicine substances are diluted to such an extent that not a single molecule are left in the potentized medicines. And they acquire the dynamic energy property. That's why homeopathic medicines are known as the energetic medicines. It increases or supports your energy, and they work on the biophysics level. Friends, these medicines there are more than 5,000 medicines proved in homeopathy, and each medicines are observed for their mental, physical symptoms. For an individual case, medicines are selected on the symptom similarity. Homeopathic medicines are suitable for the orthopedic conditions, and there are several therapeutic medications process. I am going to give you some of the few medicines because they are very useful. They have been found useful during my clinic also, and also been observed by of our friends and colleagues who are using them. The common medicines are the acid floor. It is a remarkable remedy for bone disease, carriage of the mastoid bone and other bones of the ear carriage, and necrosis of the long bone and ulcer over tibia. So necrosis conditions can be relieved to great extent with the acid floor, and especially adapted to the chronic disease with syphilitic and mercurial history, early decay of the teeth. The next medicine is aurum metallicum. It is the carriage of the cranial bone and bone of the palate are especially met by this remedy. It is an antidote to mercury and has violent pain at the night. There are offensive odor and discharges of small pieces of the bone. Pain in the bone of the extremity, given timely, it may prevent carriage, necrosis, and exotosis. Platinum muriaticum carriage especially of the teres, megarium, peritonitis. These are some other medicines also which can help removing the necrosis and prevent also. They are also acting as a preventive medicines. Now, another important medicine is asphodita. It carries an unbearable pain. If the pain is there in the bone and it is unbearable, asphodita works like wonder. Bone diseases, especially in the syphilitic organism. Here the extreme sensitiveness and throbbing, darting pain in the bone, peritoneum, painful, swollen and enlarged ulcer affecting the bone, thin itchers are there. Next medicine is calcarea floor. It is the calcium chloricum, and it is gouty enlargement. The bone when it gets enlarged, like in the rheumatic conditions, the gouty conditions, the deformed arthritis, it is very wonderful. Malnutrition of the bone, insisted tumor of the back and the wrist, and chronic synovitis of the knee joints, carries bone affections, especially rhactitis, enlargement of femur in the infants. Then another medicine is calcarea phosphor. It is phosphate of the calcium, one of the most important tissue remedy. It has a special affinity where bone form shudder or symphysis. Bone diseases, not non-immune of fractured bone, acts marvelously in tardy dentition and teething complaints. Bone are weak and fragile. It creates new bone marrow. This is very important for this medicine in adding on the bone marrow. So for the bone marrow problems also, this medicine is very effective. Then Epithelium purph. It is also known as the bone cutter because it especially works on the bone and pain in the bone. It is bone pain, and it occurs in along and one associated part is the fever. The fever with the bone pain with marked restlessness is the important indications for the Epithelium purph. Another important medicine is graphitis. It is pain in bone of feet and ankle with extreme restlessness. This is very wonderful medicine for the ankle pain and bone feet pains. Then symphytum, very common, and I have seen most of the orthopedics of the town, they are using this symphytum because has been reputations for the fractured bone and inflammations, and it helps in healing of the bone and irritability of the bone are removed. Then phosphorus, bone disease, especially necrosis and carriage of the lower jaw vertebrae and tibia. Excellent remedy for cancer of the bone and periosteum, swollen and painful abnormal formations of the bone. So phosphorus, it is called the chronicity. When the chronicity is there, leading to the cancer stage, it can be very helpful and act as a palliative to the cases where we cannot save the life. Then ruta, it is another wonderful medicine where the soft part of the bone is injured. Long bone are more affected. Spine and limb feels bruised. Leg gives out on rising from the chair. Aching pain in tendo Achilles. Pain in bone of foot and ankle, and worse, lying down in cold weather. Then causticum. It is deformities of the bone. When the bone gets deformed, arthritis deformants are there. So this medicine is very useful. Also, along with the calcarea phos and calcarea fluor, this medicine works wonderful. Bone pain which is aggravated in the night. The specialty is that the conditions type in homeopathy, the modality and sensation are very important. We take care of and we include and decide about the medicines based on the modality and sensation of the pain. Then mercurius, excellent remedy for bone disease, severe bone pains which are worst at night, and otitis, violent bone pain, swelling, nitric acid, mercurial otitis, drawing pressive pain with sensitiveness. Then silesia, it is a curvature of bone, rickets. Here it is often clearly indicated remedy, and there is present offensive stretch hip joint disease carried after the inflammations, worse from cold and POTS disease. Calcarea carb, this remedy is superior to any in the carriage of the vertebra. Curvature of the spine, rickets, and sour sweats are along with that. Phosphoric acid, this is hip disease and carriage of the spine, sensation of the bone as if scraped with a knife. It is a remedy which corresponds to the extreme debility found in the rickets. Debility is one of the prominent symptoms for this medicine, and where the patient feels as if he has got no strength at all. This is very important indications for the prescribing phosphoric acid. So homeopathy is very proficient in managing the symptoms of osteoporosis. Homeopathic treatment for osteoporosis plays a role in modifying the internal imbalance of the bone formations and reabsorption in a bid to prevent the further bone loss. What Dr. Arun Singh sir has told, that is very important. One has to take care for all those phenomena and for where these medicines can be taken, utilized according based on the symptoms severity. So the homeopathy also helps in preventing relapse of the condition. This is very important for the homeopathy. It acts as providing a permanent immunity in the patients. So homeopathy is the nature's way, and it is established some 200 years back, and it is still functioning. A lot of the controversy are there. In spite of that, the articles are reviewed and published for the homeopathy. So thank you very much for having very patient hearing. And today, our objective for this presentations and joining hand with our contemporary system, we are not the opposite. We all have the integrated approach should be there. Our Prime Minister has also is in planning that there should be an integrated, because medicines have been divided into several components, several systems, and patients are at for which system to adopt. But integrations will help when we try to understand our limitations. I understand I have limitations with the homeopathy. So these limitations can help me to think about the use and benefit that we can get from the other system of the medicine. So with these words, I thank you very much, and my special regards and thanks to Dr. Arun Singh sir for this for his nice appearance at the very. I simply say, sir, will it be possible for him? He is always ready to support us. He is always ready. Every time I have approached him for any of our programs, he was the chief guest at our Homeopathic Science Congress in Patna, I think last year. And it was, and at other times also, he is always ready to support us. He's a very open person. I am very much grateful to you, sir, for you being present with us. Thank you. Dr.
Thank you so much, Dr. Sani, sir. Yes, sir. Thank you so much, Dr. Sani, sir, for a very informative presentation over role of homeopathy in several disease condition of bone. And rightly you said that the integration is very important. Today's presentation, it was like combo presentation of homeopathy and allopathy, and scope and limitation. You have very nicely talked about the scopes and limitation of the system. So it was really a very realizable combo, I can say, presentation of allopathy and homeopathy in disease of bone. So thanks to all the eminent speaker of today for your valuable presentation, sir. And one thing I would like to share over here, which I have got from Dr. Arun Singh, sir, a lesson, a very good lesson, which I used to share with my students. Triple A lesson, triple A. Very long time back when I was in clinic of Dr. Arun Singh, sir, and he taught me, that three things keep in your mind. Triple A. The first one is the availability. Whatever the time you have mentioned in your clinic, at the board, that you have to be there, available there, whether the patient is there or not, but you have to be there. So first A is availability. Second one is the ability. So just try to improve your knowledge and ability. If you are alone, no patient is there, try to read out the subject, try to get involved in your subject and improve your ability. And the third A is the affability. So be very kind to the patients, be affectionate. So it really worked, sir. And especially for me, I'm thankful to you. Thank you so much, sir, for being always an inspiration. So thank you so much, sir. And
Thank you.
now, I think some question answer session will be there. Dr. Saswat, if any question is there, just
Yeah,
put
yeah,
in front of
definitely.
them, sir.
I'll
Yeah. Yeah.
Thank you everyone for such a wonderful presentation. Me being a student and taking guidance from all of you, and with it was such a great pleasure about learning things which I'm going to learn, which are if I was not here, I would have learned about these things in coming 5 or 6 years or 7 years. But learning it right now, grasping those things and applying those things in my studies will help me a lot, and it will also uh, be like a sunrise in my career, in my homeopathic career. So thank you so much for being that light, and I'm very obliged to be here. And thank you, Bjan. First of all, I would like to thank Bjan for such a wonderful session, organizing such a wonderful session where I could, and each and every of our audience which are present here, everyone could grasp each and everything which is related to arthritis and osteoporosis. So I would like each and every one of the viewer present here to ask any of the questions which you want to ask. You can type it in the chat box. I'll dictate the questions to the sir, and they'll answer it respectively. Is there anyone here who wants to ask any question? Sir, I don't think so. Anyone is asking questions, and that is actually a good sign, because uh, if you presented the presentation in such a subtle and a very good manner, everyone can understand it, and there'll be no questions asked. But then also I'll wait for like 2 or 3 minutes and I'll give the audience time to ask the questions and assess the things which they want to ask. I don't think so, sir. Anyone is going to ask any questions, because the session was very wonderful and it was very informative. So thank you so much for being here and guiding us. And it is being an honor of being a part of this. Thank you so
Thank
much.
you very much. Thank you.
Thank you,
प्रणाम
Shashwat.
सर.
Thank you
प्रणाम
so
और
much.
आशीर्वाद मेरे ऊपर
Pranam,
और
sir.
बना रहे.
Thank you.
प्रणाम सर.
Thank you very much for giving me this opportunity.
जी
Thank
बिल्कुल. जी सर.
Pranam, sir. Pranam, sir.
you.
प्रणाम.
Pranam.